Well, it's 12 o'clock Eastern time, so I would love to get started. We have a full agenda. Thank you for joining. We are going to learn so much today. Our team is really grateful that you've taken time out of your day to join us and be part of this conversation. This is the Canadian Medication Safety Network webinar with the theme of the impact of technology on medication safety. My name is Melissa Sheldrick, and I'm the Patient and Family Advisor here at ISMP Canada. And again, where are you joining us from? Let us know in the chat box. Whoops. You'll see that we have people all across the country who join us for these webinars, so it's exciting to see where everybody comes from. Suma is our amazing tech host for today, and thank you, Suma, for doing that. Alice Watt is also supporting with tech. So if you run into any troubles, please do reach out to either one of them and somebody will be able to help you. You can do that through the chat function. So a reminder for all of you, you are a network member, which means that you are eligible to receive a 10% discount off of ISMP Canada education workshops and modules. We have a whole selection of them. I would encourage you to look at our website, ismpcanada.ca/education. For upcoming dates and information to register. And if you're interested in registering for any of these, please send an email to education@ismpcanada.ca. You can write in that code CMSN #1 and we will help you to get that organized for you. We are looking for engagement with more and more people and wondering if any of you would like to use your voice to help advance medication safety. So we, as you may know, we publish safety bulletins for healthcare providers and newsletters for consumers. And we are always looking for people to review these documents before we publish them. And so if that is something that interests you, we would love to hear from you. For healthcare providers, if you sent us an email at medsafety@ismpcanada.ca and just let us know what areas of expertise you bring with you. So for example, oncology or neurology or quality improvement, we would look to call upon you when we are publishing a safety bulletin with that topic area. And for consumers, we look for people who are able to review 2 to 4 one-page newsletters per year. And so if that's of interest to you, please do contact us at medsafety@ismpcanada.ca and we'll be sure and get back to you. So I would like to acknowledge the ISMP Canada land acknowledgement, and it is based on the location of our office in Toronto. We acknowledge we're hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. And if you would like, you can also add your land acknowledgement in the chat box. So this is our timeline for today. We have a full schedule for you until 1 p.m. Eastern. We're going to begin with a short introduction, and then we are so privileged to welcome our guest speakers today, Susan and Dima. And then after that, I'll come back and we'll send you out to your breakout rooms for 30 minutes. And when we come back together, we'll share just one gem that you want to share with us from your breakout room and finish up the webinar by 1. So we want to learn more from you. together, we all improve medication safety, so it's important to continue to hear your voice. We're going to launch a poll in a moment that will have 3 questions, and when it pops up, you have to scroll down to see all of the questions and to answer all the questions. So, what is your primary role in healthcare? Have you or someone you know experienced an issue with the safety of medication? And have you attended a previous CMSN webinar? I skipped my page. There we go. So let's get that poll launched. Here we go. There we go. So if you could take a moment to answer that poll. Thank you. I see them already coming in. Oh, I've launched the wrong poll. That's okay. Let's Suma, which poll is showing now?
It's showing the second poll.
Okay, that's okay.
I can launch the correct one.
Could you? Yeah, thank you. See, this is why Suma is our technical master. Should not be left in my hands. There we go. What is your primary role in healthcare? Have you or someone you know experienced an issue with the safety of medications, and have you attended a previous CMSN webinar? Thank you to those of you who have come back. It's really important to us to know that this is of value to you. And welcome to those of you who are here for us here for the first time today. So we have a wide variety of folks, pharmacy team members, nurse, quality improvement, patient safety. And this, we ask every time, you know, has somebody experienced a medication incident? And overwhelmingly, the answer is always yes. So there is more work to be done, and glad that we're all here to be able to do it together. So thanks, Suma. As we know, technology has a major influence in our daily life. And while it can be very helpful in the day-to-day, there are inherent risks that we have to be aware of. And when we consider the need for technology to reduce preventable medication errors, there are definite benefits, but there are also some unintended consequences that could occur. And medication safety is a cornerstone of patient care. In fact, ensuring the right medication is administered at the right dose at the right time and to the right patient is fundamental to quality care. However, even with rigorous safety protocols, and errors and inefficiencies can still occur, potentially leading to harm. So over the next hour, we'll explore how technology, including artificial intelligence, technology solutions like mobile health apps, emergency preparedness systems, and hospital technology platforms is transforming medication safety. And your conversation in the breakout rooms will help each other to learn about experiences and opportunities that have happened or may exist. So artificial intelligence, we hear a lot about this, has potential to revolutionize medication safety by predicting and preventing medication errors even before they occur. When we look at all of these arms of AI that are on the slide, we can only imagine the potential for improved safety for patients. Advanced AI algorithms can rapidly analyze vast amounts of patient data, identifying patterns that provide clear signals and pathways. And the ability to harness AI for predictive analytics is changing the landscape of medication management, and it's helping to reduce those risks associated with manual decision making. And yet, of course, there are risks that are still present despite the capabilities of AI. Mobile health apps, patient portals, connected care systems are just some examples of tools that help empower patients to take an active role in their healthcare. Apps designed for medication management can remind patients when to take their medications and track dosages. And we know that communication breakdowns can be contributing factors for errors. And these systems can help enhance connectivity between health teams. So let's consider the role of technology in emergency preparedness. During crises such as natural disasters, pandemics, cybersecurity emergencies, maintaining access to critical medications at all levels becomes a major challenge. Technology plays a huge role in ensuring that medication supply chains remain intact and that patients have access to the drugs they need, even in the midst of chaos. And real-time inventory tracking system, data-driven supply chain and management, and automated dispensing systems can be the difference between life and death during an emergency. And in moments where every second counts, having technology to help guide those decisions is truly invaluable. And then within hospitals, technology systems like automated dispensing machines, smart pumps, and electronic health records, they all can work in tandem to significantly reduce the risk of medication errors. But I'm not going to say anything more about it because we have two experts who have come to join us today. And I am so pleased to be able to introduce you to Susan Sameo, who is Director of Pharmacy and Medication Management at Mackenzie Health, and Dima Nusir, who's Manager of Quality and Patient Safety at Mackenzie Health. And I'm pleased to be able to pass the screen over to them. So take it away. Thank you both for being here today.
Thank you so much, Melissa. I hope everyone can hear me fine. My name is Susan Sameo, as Melissa introduced me. Thank you for taking the time to join the conversation today. I'm looking forward to the breakout sessions in particular and hope that I can share a little bit about our experience at Mackenzie Health. So Dima is going to be joining me in the breakout room later and has been sort of working behind the scenes to help prepare the presentation that I'm going to be walking through with everyone today. So thank you, Dima. And I'll just declare I don't have any conflicts of interest. I may, throughout the presentation, refer to some of the proprietary names of the technology solutions that we use, but really they're just representative of sort of the vast array of technology that is available for us to use. And I'm not advocating for one or the other. Happy to have offline conversations if people have particular questions, but really this isn't about the technology, but more around how we leverage technology as medication safeguards. So who we are, Mackenzie Health, we are located in York Region, which is just north of the Greater Toronto Area. We like using this slide because it just shows sort of the growth in our region. We are one of the fastest growing communities in Canada, and as such, in 2011, we received approval to build a second site, being the first net new hospital in Ontario in over 30 years. So we, in 2021, opened the Cordalucci Vaughan Hospital, and we're now a multi-site hospital with three main locations, as well as several off-site locations as well. You see our stats here. I'm not going to go through it, but essentially the Mackenzie, Richmond Hill, and the Cordalucci Vaughan Hospital have fully operational pharmacy departments with some of the technologies that I'm going to be discussing with everyone today. You may have heard of Cordalucci Vaughan Hospital. When we opened in 2021, branded as Canada's first smart hospital. And of course, in order to be smart, that means you're leveraging lots of technology in these days. Again, just to keep the scope of the conversation quite focused on medication safeguards, I'll be referring mainly to the pharmacy related technologies that we've implemented. I can go to the next slide, please. So just in terms of background and just to sort of ground the conversation today, on the left, you'll see our corporate strategic plan. Of course, many of those elements I'm sure are familiar to many of you, particularly if you work in an acute care or any sort of healthcare environment. Our primary goals being patient care excellence, making sure that we keep our people, our employees and our staff and our patients and our volunteers top of mind as we navigate through this complicated journey. Integrated care more important than ever, and growing with our communities as we look at the transitions of care from our acute care settings to all the other settings that are available, accessible for patients, that we've had to leverage over the years. On the right is probably a more new sort of concept that I'd like to share with everyone today. And I'll keep referring back to this medication management framework several years ago with sort of, the increased vigilance in the pharmacy landscape in terms of oversight, monitoring, governance, the complexities that were coming in with technologies coming in, and of course the heightened conversations around medication quality and safety. We were trying to find a way to sort of frame the conversation and make sure that we're using common language in our organization, from the front line, from within our department, all the way through to our board of directors. And so we set out on a journey to establish what we were then considering to be a medication safety framework. And as we started to look into that, it quickly evolved into a medication management framework, realizing that safety is a major component of medication management, but not the only one. And so we were able to sort of establish the 4 pillars of governance and oversight, clinical care excellence, responsible utilization, and of course, medication quality and safety, to leverage our framework. And in the inner colorful circle of are the different elements of medication management many of us know, and of course it's our bread and butter in the pharmacy world. But it's this visual has been quite helpful in framing the context that medication management is not only about preparation and dispensing and administration, which are kind of the elements that we most often think about, but really there's elements behind the scenes in procurement and storage, and of course the ongoing monitoring and dispensing, that all really need to be taken into account. And when we're leveraging our enablers such as technology, it's important to keep all of those elements top of mind. We can advance to the next slide, please. Something in our organization I wanted to just touch upon as well. In 2019, we had established a quality and patient safety framework that really leveraged zero harm as a key guiding principle, and several quality aims were sort of developed. And as we continued on in that quality and safety journey, strategic choice was sort of highlighted in terms of how we make decisions within the organization. And we did in 2022 make a strategic choice to pursue highly reliable care in order to achieve that journey of, or that ultimate goal of zero harm. And that's when we partnered with an organization called Press Ganey in order to implement and leverage high reliability principles throughout the organization. And really this journey was about empowering every person that came through the doors of Mackenzie Health to be able to make choices about safer functions, safer experiences while they were with Mackenzie Health. And so there on the right, you will see a number of the tactics that we've used here, but just to share that we are well established with our high reliability principles, and really embedding that within the culture of the organization. We can go to the next slide. This is not going to be anything new for anyone, for many of you that are on the call today. And we've talked about the hierarchy of effectiveness as it relates to medications for a very long time, through the work primarily of ISMP. I'm just going to ground sort of the next pieces that I walk through with everyone in this work around the hierarchy of effectiveness, which is also a key component of our high reliability journey. Reminding people that less effective strategies around rules and policies and education. When we think back to about 10, maybe even 15 years ago, a lot of our strategies around safety were around education and making sure that we had policies in place. And as we're advancing in terms of the technology that's available to us for medication management, we're getting up into those medium and high leverage or more effective safeguards. And I'm going to refer to that as we go on to the next slide. It's a little bit of a busy slide, and it's a little bit of I apologize for the smaller font on this. This slide is really just intended to showcase how we can sort of categorize our thinking in terms of medication safeguards. And started to do this a couple of years ago as we were, reviewing our high alert policy and thinking through the safeguards, because we talk about labeling, we talk about policies and education and audits and all those wonderful things, and really started to think about, but are these really the most effective safeguards? What are some of the more effective safeguards? And just try to sort of form this visual of what safeguards do we have in place to support safe medication management. And I'm not going to go through every single one, but I do want to just maybe showcase some of the more effective technologies that we have leveraged, starting with CPOE, electronic MARS. We are a HIMSS level 7 organization, which means we have over 95% compliance with barcode medication administration and electronic documentation from medication orders to physician notes. We do have a patient portal that we leverage. The medication component is something that we're always we're just currently sort of talking about enhancing as well. Very careful that when we do that we do so in a safe way. And then what I wanted to also highlight here is, again, thinking through the different components of medication management and those behind the scenes components of procurement and storage. And as we do have automation in our central pharmacy, different automation at each site. These are more effective safeguards that we have in place. But sometimes we have some big debates internally about whether they're most effective or moderately effective, because there aren't always extreme force functions in place that always lead the user to do the right thing. And the conversation, particularly in our high reliability environment, is great. We have the technology, we have the safeguards, they're more effective safeguards. How do we push that envelope just to make sure that we're leveraging the force functions and making them the most effective safeguards? Many of you will find these technologies very familiar, but I just want to maybe call out in terms of the dispensing and even the administration, there's safeguards that are more policy or procedural that we can leverage using some of the technology. So the technology is there, but the safeguard in the technology really comes to life as moderately effective or most effective in how we implement it. And a great example of that is the ADUs, the automated dispensing cabinets that we have. So from a storage perspective, we can absolutely, say that we have a more effective safeguard in place by having automated dispensing cabinets. But how we leverage that technology, do we limit to five character searches on our ADUs? Do we profile dispense from our ADUs? Do we restrict the medications that we allow to override on our ADUs? These are some of the decisions that then, force us into those conversations of whether we are leveraging that technology as a moderate safeguard or a more effective, highly effective safeguard. So I just wanted to call that out. And another great example of that, which I want to showcase, is infusion pumps that we use for administration. Many of us have now transitioned or have infusion pumps, smart pumps in our organizations. And what makes them smart pumps is the drug error reduction software, and that is absolutely, the recommendation from a safety perspective, to have the drug error reduction software in place. Again, drug error reduction software serves as a limit, as a rule, as an alert in the system to help our providers really do the right thing where it comes time to leverage technology. Where we can push the envelope, and where, our organization is very proud that in the last year we've been the first organization in Canada to introduce bidirectional infusion pump interoperability with our electronic medical record and our infusion pumps. First in Canada, but not first in the world. The US has been doing this for a very long time. And again, just speaks to that conversation about being able, what do we need in order to be able to leverage these safeguards in the most effective way that we have. When we talk about bidirectional interoperability, it's the flow of the medication order from our electronic record into the pump so that the nurse doesn't have to program it. And we have been fortunate to reduce our medication errors that we're seeing with respect to infusion pump programming by leveraging this safeguard in a very, very short amount of time. So very proud of that work as well.
Thanks, Susan. Sorry to interrupt. If we, would you be able to sort of wrap it up in a couple of minutes so we can go to our breakout rooms? I'm sorry, this is fascinating and we're so
absolutely grateful. Yes, for sure, no problem. So this is just the tools many of you are familiar with. We can skip over this, Melissa. And I just wanted to sort of highlight, again, in thinking through, how do we leverage technology? I think I'll just make two key points with this slide. One being making sure that we have the appropriate stakeholders engaged, and two being to really leverage our local data, our medication incidents, our trending, our monitoring of our key performance indicators and our internal risk assessments to figure out how do we leverage our technology in a more effective, more meaningful way, but also which technology should we be pursuing. And then we can go to the last slide, Melissa, so that we can move on to the breakouts. And again, just looking at along the way, the different considerations with technology at all the different stages of medication management. One of the things I really want to highlight is every time there's a product change, every organization is, I want to say, burdened with making sure that that product is evaluated for the appropriate safeguards. And in this world of technology that we're living in with multiple systems, it just adds a layer of complexity, a layer of safeguard that can be so meaningful, but also a layer of vigilance that's really required in order to do that. Okay.
Well, I can't thank you enough. It's just fascinating, and what incredible work the whole team has done. So thank you for sharing it. And those of you who are in the hospital technology breakout room will have more opportunities to learn about this. And so with that, I am going to ask Suma to send all of you to your chosen breakout room. And if you don't go right away, just stay in the main room and we will be sure and get you there as quickly as possible. So Suma, you can send everybody off. Sure. And we'll see you in a little bit. I had the privilege of jumping to a couple of them and there was some incredible discussion going on. So facilitators, we have time for one gem from your breakout room. We may not get to everyone, but is there somebody who wants to unmute and just tell us perhaps one thing that from your breakout room that you want to share with everybody?
I can start, Melissa. Thank you. We had a really interesting discussion on emergency preparedness, sort of disaster planning, both internal and external disasters. And I think the one big takeaway from this is, yes, there's infrastructure problems. Yes, there's computer problems, but there's a lot of affected residents, patients, staff. It's very emotionally disturbing. There's a huge burden on everybody who's participating.
Absolutely. Thank you. Yes, it is very far reaching. I think farther than we can imagine, which sort of underscores that importance of hearing from all stakeholders to hear all those perspectives. Thank you. Julie, I saw your hand was raised.
Thanks, Melissa. We were in one of the technology solutions teams, and our gem is, with all this technology, the importance of live simulation of downtime situations, that we need to expect that the technology is not always going to be reliable. We had someone in our group talking about the cyber attacks to the Southwestern Ontario hospitals last year, and also the cyber attack on a Western pharmacy chain and how that impacts. And so that actually practicing how you're going to manage when things go down and not having to figure it out in the moment.
Absolutely. Thank you. Carolyn?
I had the pleasure of talking with a great group. It sounds like we all did. And in the group, there was a group within the group from Alberta, community providers, community care providers, and they've gone to provincial Connect Care in Alberta. And one of the great upsides is a very good BPMH, or best possible medication history module, that they have, which is exciting. But the downside in that location is it's not connected to community pharmacies, at least not at this point. So a great tool, but missing a big important connection. But they're on the journey. They're headed in the right direction.
Perfect. Thank you. And I see there's other hands raised, but I can't see who they are. So if you could just go ahead and unmute.
Okay, great. It's Alice, and our group had a great discussion. I think Sam was going to share a little bit about the AI use case that they use.
Hi, yeah, we were talking about different use cases, and one is around diversion awareness software, often attached to the ADC. Our organization luckily has some, and it can identify a diversion within 7 days of starting a position, and it just takes out all the hours and hours and hours that a human would need to comb through all that data and has it within a matter of minutes.
It's fascinating. Fascinating. Thank you. We have time for one more.
I can jump in. It's Ina.
Tina.
Amazing group. So grateful to Corey and Sally and Nicholas, pharmacists all across the board, all across the country, all working in quality improvement and incident reporting. Do any of you want to jump in? We ran out of time. We were having so much conversation. Corey, Sally, you guys had some amazing thoughts. I'm happy to share, but I want to give you the opportunity in case you want to jump in. Nope. Quiet. Okay. Some major pearls that there needs to be more standardization across the country in incident reporting standards from regulatory bodies. We still need that human filter because it's a little bit about the quality of reports that are coming in. And are we able to discern what we really need to? Are we able to pull out important information to make patient safety decisions? We don't, as a group, feel we're there yet. So I think there's more work to be done. There's therapeutic really doesn't get talked about in this process. Systems are cumbersome, and staff feel like it's still work and it's not a priority. So culture, safety culture, just culture is all a part of this conversation. So that's the pearls that came out of our group.
Incredible. Thank you all, facilitators, and those of you who took notes. I wish we had longer to learn more. There will be a full report with all of this learning on our website. You can go to our website and look for the network under the resources tab, and you'll see our reports from our past webinars. And so that will come up within the next couple of weeks. So we do have one more poll. As you know, your voice is important. Sumi, you could go ahead and launch it, please. And we want to hear what you want to talk about and learn about at a future meeting. So your choices are how to give and share effective feedback for reporting incidents, medication incidents. What's the best way to close the loop with that process? Is it look-alike, sound-alike medications, high alert medications, and opioids? Do you want to learn more about labeling and packaging issues? Advocacy 101, what does that look like and how do you do it? There's been a lot of talk of shortages, various shortages, drug shortages, primary care shortages, doctor shortages. And then finally, the overprescribing of medications at all different, we often will hear about that with older adults, but we do hear about it from all age groups. So all important topics of conversation. So, okay, that looks terrific. What great feedback for us. Thank you so much. You could go ahead and share the results, Suma. So we are going to ask you to please complete a survey about today's webinar. So the QR code is there, and I've just put the link into the chat box as well. And if you could take 2 minutes to do that, it's really helpful for us. Like I said, your voice informs these webinars and gives us information about what you want to know about, and also information about perhaps what's needed across the country, and can help inform the safety bulletins and consumer newsletters that we have. You can find us on LinkedIn, and then you can also find previous webinar information on our website through that QR code too. And again, if you would like to be a reviewer for our safety bulletins for healthcare providers or our consumer newsletters, if you have a particular expertise, healthcare providers, that you want to share with us to review any future safety bulletins, please let us know at medsafety@ismpcanada.ca. Our consumer newsletters are published 12 times a year, but we ask for people to review 2 or 3 or 4 of them. And they're just 1 page per year. So excited to be able to engage with those of you who are willing to support us with that. And we're just really grateful that you attended today. Thank you for taking the time. Thank you so much to Susan and Dima for your incredible presentation and for being with us today and taking the breakout room. Facilitators, note takers, thank you for your preparation and your work today. And Suma, thank you for your tech support as well. And with that, I wish you a good rest of the day and hope to see you at the next webinar. Watch your inboxes for that. Thanks, everybody. Have a really good day.
Bye, everyone. Take care.
Bye.